Everybody, I'm so happy to be joined with Miss Christina Brubaker. Am I saying the last name correctly?
Yes, ma'am.
Yes, I got it. Christina, thank you so much for spending your time with me for a few minutes and sharing your story from the front line. If you would please give the viewers a little bit of information about yourself, where you're from, what you do.
Well, I grew up here in Sinton, Texas, and now I'm working with the San Patricio County Health Department here in Sinton. This is the seat of San Patricio County. So we host the entire health department, environmental health, emergency management is in our building as well. And that's where I'm stationed.
Wow. Now tell us where, because I don't really know where that city is. So give us like the closest big city to that city that you just described.
We are about 20 miles northwest of Corpus Christi, Texas. So we're on the coast of
Oh,
Texas. Mm-hmm.
that's why before we started, you said, two hurricanes back to back.
Yeah, it's a
Okay.
season for us. Yeah.
Wow. I'm going to switch the view here from speaker to speaker view so that they see all of you when you're talking. That's certainly, oh my God, I want to ask about that. But first of all, tell us about what you do day to day. And then I'll ask kind of like how the hurricanes impact what you do. So tell us a little bit about what you do day to day.
Okay, I'm the education aide for our community clinical health bridge project. We work with community-based programs, and we are designed to help people who are trying to avoid diabetes, people who are pre-diabetic, who have been referred by their doctor or their clinic to our program to get some help with nutrition information, physical education. That is my role. But with COVID, we have been asked, our department has been asked to step up and step in and the role of COVID hotline. So we also answer incoming calls to help field calls away from the emergency management department that's a little overwhelmed. So we come in, both hands, and we just help out wherever we can.
Wow. So you're literally boots on the ground.
Boots on the ground, yes,
So
ma'am.
tell me what that looks like, because when you have a threat of a hurricane and you're saying, you're coming in to help man the lines. Give me an example of what that day looks like.
Well, thankfully, we have not had to, um, step. I'm sorry. Can you let me think about that for a second?
Okay, no, not a problem.
Okay. So we expect during hurricane season to have close calls, and this year has been close calls, but our emergency management team is always prepared. They have meeting after meeting to get us ready to expect the unexpected. So our role, should we have to step in, is to answer phone calls that come in, people that want to know where to evacuate, when can they expect a bus, where do they need to go, who do they need to call. If they have no means to get to a location, we have to help them set up transportation. So thankfully, we haven't had to use that resource this year in our area, but I know that other areas have. It's something that we always prepare for every year. They have meetings as early as April and May, getting ready for the season, just to let everyone know what's in place, where we stand, and who they're going to call when it's your time to step in and do your part.
Wow. I like that you
Mhm.
said expect the unexpected. And, I thought in talking with you tonight, we will be definitely talking about how COVID-19 has affected kind of your day to day operations. And even though I know you just said it's just been a couple of close calls, I remember I was in Houston working Harvey when that event happened a couple of years ago. I couldn't imagine working the GRB shelter with and having to worry about physical and social distancing. I
Distance.
could not imagine. So it just adds another layer of complication on top of things.
It does. And the people that sit down and plan for this, they have thought it out so very thoroughly to make sure that everyone is taken care of, everyone's needs. If there's special needs, if they need to make accommodations for a handicap or infirm, elderly, they're all taken care of, from person down to pets. So we have a really good team here.
Wow. It sounds like it. Sounds like you got a good leadership team. So tell the viewers, what is your job duty or what are your job duties on a daily basis? And how have those duties changed in light of COVID-19?
Well, right now, because of COVID, our project is virtual only. We're not allowed to meet with our clients in person. So we've had to take to the phones and take to Zoom and create our program, and not just individual, but in group sessions. And we have yet to have our first session this year because of COVID. Our facilities that were going to be made available to us canceled. They weren't allowed to host 6 to 10 people in a room anymore. So we had to come up with, plan XYZ
Mhm.
to figure out how we're going to make this happen. So right now we're kind of on pause, but we're excited. We have some referrals coming in, and we're looking forward to resuming our project here in October. But with COVID, not only did it bring our project to a standstill, which was frustrating for us and our clients, but we had to change gears and now be a calming voice on the other end of a line. Whereas before, we were trying to help people take positive steps with health and nutrition. Now we're answering calls from people who are frantic and full of fear, worried about their families, and trying to, where do I go? Where do I go to take a test? Or I received a letter from the county telling me I have to stay put for 2 weeks. I have a job. I have kids I have to take care of. What do I do? So when you answer that phone, you don't know who is going to be on the other end of the line and what their situation is, but you immediately go into, I'm here to help. You listen, you have to be the calm voice, and you try to direct them any way, that they need to go to get the information they need. And if I don't have the answer, I get their name and number. I go find the answer and I call them right back as soon as I can. Because that's our community, and they need us.
Wow. It's definitely much needed work. And I mean, it sounds like you, again, you're doing community health working at its core. So I can see certainly how things have changed. I hope, as a diabetes educator myself, I'm crossing my fingers. I hope you can get your classes up and running next month. There's so much benefit to the virtual technology that's available. I know everybody's probably Zoomed to death. We're all tired of the meetings virtually and working virtually. But I really try to look on the bright side of things, and there's a lot more probably positives than negatives when it comes to this virtual space and virtual capability that we have now. So I'm going to ask you, like I asked the last person that I interviewed.
Mhm.
We know the challenges, we know the barriers that have come with living in COVID-19 now, but can you share at least one or maybe more positives that you've encountered since kind of your duties have changed a little bit since COVID-19?
Yes, and I am thankful to you because I took your COVID preparation classes back in April.
April, yes,
And
April.
I myself was under quarantine at that time because I tested negative, but I was self quarantining until my results came back. And during that time, I took your classes, and thankfully, it applied to what I'm doing now. So, um, learning how to take care of myself as the worker was important because that's what kept me positive when things get really stressful, when I feel overwhelmed, when I feel like I can't take one more phone call. I remember that there are times where you have to step away and just regroup and recenter yourself, and it helps me to get through the day. So I really appreciated those courses that I took with you.
Wow. Wow. I'm so glad that resonated with you. I should probably do that presentation again because the CDC has, things change every week, sometimes every
Yes,
day. And I remember
yes.
back when I did that, the recommendation for quarantine and isolation was 14 days. And now
Mm,
those dates have changed. So a refresher
good.
presentation may be in the works in the next couple of weeks. So I'm so glad you found that helpful and beneficial. I hope that everybody that's listening to this has been really inspired. You are doing some great work, and I'm just so appreciative that you took the time to spend this evening with me, sharing your story from the front line. And I look forward to speaking with you again in the very near future, Christina.
Thank you very much.
Thank you. Talk soon. Bye-bye.